Doctors across the UK will begin the rollout of 500,000 doses of the Oxford coronavirus vaccine. But there are questions over the speed at which those most at risk across the country will receive their jabs, and concerns over the government's decision to delay offering the public second doses of both the Oxford and Pfizer vaccines. Here's our science editor, David Shukman.
It began with a blaze of publicity, and now the vaccination programme moves up a gear to try to protect tens of millions of people now that a second type of vaccine is about to be deployed.
I hear from particularly my general practice colleagues up and down the country that they are raring to go. They're really, really busy, but they also know that this is the best thing that they can do to protect their patients. So as supply allows, more sites will be able to offer the vaccine, and that's exactly what we need to aim for.
The big hope is the Oxford AstraZeneca vaccine. It's easy to handle. It doesn't need to be stored in extreme cold. And the first doses are due to be given tomorrow. So in the coming months, how will this mass programme take shape? Well, the government's ambition is that by Easter, that's April the 4th, to have reached something like 30 million people. They're the most at risk, over 50s, health and care workers and adults with vulnerabilities. That involves around 2 million injections every week, and for many people that'll be their first dose only. All of this depends on two key factors: production, can it be ramped up sufficiently, and also delivery. Will it be smooth in this massive operation? This comes as government advisors say it's better to delay giving second doses so that more people can quickly get a first dose and at least have some protection. But Pfizer says this idea hasn't been tested for its vaccine, and some leading scientists want more research.
I think it's so important that with this decision that's been made, that there are actually scientific studies that go on to look at the effect of delaying the second dose. I personally think that it may well produce as good or better an immune response, but we really need to study it.
Sites like this offer hope of a way out of the pandemic. The challenge now is making sure the vaccines get used as effectively as possible. David Shukman, BBC News.